Over 30 drugs regularly used by patients has become more affordable. The NPPA, or the National Pharma Pricing Authority, in its 2022 review has included a total of 34 drugs and deleted 26 from the national list of essential medicines. This means the prices of the drugs included will be capped and can't be sold above a certain fixed price. The criteria for choosing the drugs are that it should be safe and which are widely used. The NLEM now consists of a total of 384 drugs across over 25 therapies. The 34 drugs totally are valued at anywhere between 5 to 6,000 crores and range from antibiotics such as meropenem, anti-allergy drug Montelukast, diabetic drugs such as insulin GLARGINE, the commonly used antifungal drug itraconazole, nicotine replacement therapy, to the COVID-19 linked drug antiparasitic ivermectin. Many of the drugs on the list, point out experts, are used in hospital and intensive care settings. While the price caps are yet to be decided and will be based on an average of the top-selling drugs, estimates are the prices of some drugs could be reduced by up to 20 to 25%. An example is the diabetic drug insulin GLARGINE. Today, majority of the market uses human insulin. Some estimates are even up to 80%. In the insulin GLARGINE market, Sanofi's drug Lantus is currently the market leader, priced at close to 800 rupees. Now, with the inclusion of insulin GLARGINE in the NLEM, the price of Lantus could reduce to a little over 630, making it more affordable, allowing patients accessibility to a more modern insulin than the commonly used human insulin. Experts point out drugs, especially those used for chronic conditions that could ease the burden on consumers, include teneligliptin for diabetes, dabigatran for clots, and drugs such as tenofovir for those suffering from liver conditions or HIV. So yes, while the price reduction is a relief for patients, what is the impact on companies? Not much, say analysts. In fact, it is viewed as an overhang being removed, since the next review is expected to be only 3 years later. Also, one has to see the extent of price reduction, and lastly, companies could compensate the price reduction by selling higher volumes and growing other portfolio brands. No, the drugs put under price control are expected to be only 2.5 to 3% of the total industry. Sales of these 34 drugs totally are expected to be mid to single digits. Indian pharma market growth, which is estimated at low double digits, could reduce to mid to high single digits this year. But in the long run, IPM growth, which has been 10 to 11% in the past 8 years, is expected to continue growing at that rate at least for the next decade, led by factors such as higher per capita income, growth in insurance, awareness in rural markets, and of course, higher burden of lifestyle-led diseases.